Hello everyone, thank you so much for your support on my previous video. I'm with a new video today. Today I will be speaking and keeping my thoughts about the APF book. It is the Australian Pharmaceutical Formulary and Handbook that I bought on 2024 when I appeared my exam. Okay, that is I think they have changed. I think they have the 27 or the 28 version now. I'm not quite sure. I think that should be 27, APF 27. I will highly recommend you to invest on this in the AMH because it will be helpful on your like whole journey of your career after finishing your exam. Also, it will be more helpful. And with this one, there are some of the portion which are really important. It has the it will cover a main topic that includes the compounding. It will include the label, all the labeling, cautionary labels, and all the labels that you used in the dispensary. And third thing, it has the own management on this one. It has the pharmacokinetics of some of the drug, not all the drug. And it has the treatment guidelines for pharmacist, which is the S3 medication. Okay, it has like when to refer the patient and what is the drug of choice and what might be the secondary option, or what might be the care plan for that disease condition. It has all the things on that one. So if you are preparing from now for your exam, I will highly recommend to go through the S3 at first, S to S3, because in your primary healthcare, like the first section of your exam on the intern exam, they will ask about the primary healthcare, that they will ask about any of the disease condition that you can easily treat on the pharmacy by giving either S2 or the S3 medication, sometimes just with the counseling and the referral. Okay, so I'll recommend to go through this book. And there is the note, I think I have seen on I got that from one of the group, and I think there's some Mustafa Wali group on the WhatsApp group. They have the note. It's a Lloyd, I think Lloyd OTC medication list with the picture, and it has many things. You can go through that one as well as just refer this book. Okay, because it has many of the thing that for the S3, all the information that you need for the S3, like for example when to refer the patient and what to do if they have like a certain disease condition. You can't treat that on the pharmacy, obviously. So when to refer the patient, what to give on that condition, it has all the information. Okay, and going through one by one, I'll just say, you can highlight, like as I have done, like for the tagging I have done cautionary labels, and they has all the label, like label 9, label 5, label 7b, label 10b, label 11, and label 1, label 6. With this label, all the label are not totally important. Remember, label 1 is the compulsory label. You need to, if you are dispensing any medication with the label 1 or the label 1A, it is compulsory. You need to put that on the packaging. Okay, otherwise, I'll recommend, if you are the intern pharmacist, just put all the label that is required on that medication, like a main label. For example, if you are dispensing any any antidepressant like fluoxetine, then it is 5912. I'll recommend just go with 5912, all the label on that packaging. Okay, and if there is any medication, for example duloxetine, there is the compulsory label 1. Don't miss that one. Okay, so if you are an intern pharmacist and doing the retail job, either in the hospital, either in the retail community, then I'll recommend just follow the label. Okay, because if you put that label, you will remember those things. And second thing, you will remember most thing while doing counseling, and you can remember those things on your exam too. It is the best idea to look after the counseling, because for example, if you have the label on the packaging, if you are dealing with some patient and you are counseling them on those medication, then you can quickly have a look on the label too, and like add some point on the counseling too. Okay, so label is so much important, guys. So if you are, as I mentioned, if you are intern, then just go through every label. Okay, on the packaging after dispensing. And second thing, I have gone, let me check. Okay. Mm, okay, I have just highlighted the medical abbreviations because with this one, the short term, for example, if you have seen anything written 1 BD, that means twice daily, TDS 3 times a day, or QID 4 times a day, PRN whenever required. Okay, those are the all the short form that doctor use on their prescription. Okay, that all the short form are over here on this APF, like APF book too. Okay, it is important just highlight this section also, because sometimes in the written exam you might see some of the questions saying like some of the question with the short form. Okay, so just highlight in case. And I will go directly to the opioid conversion. Okay, opioid conversion, this is one of the important topic. Okay, in the exam you will get something like, okay. Mm, okay, here is the common table 6.4 on the page number 386 of APF 26. Here is the table daily dose of morphine in per 24 hour, that is 60 daily dose of IV. Okay, oral morphine, that is 60 to 134. It is equivalent to the fentanyl patch strength of 25 microgram per hour. Okay, this question is so common on your might be on your oral exam. It is so common on the written exam. I have seen many questions regarding that one. So highlight on the opioid conversion. Okay, don't forget that one. And there was one common question on this one, that is breakthrough pain. Just highlight this topic too. It is so much important, since it in the exam you will be getting the questions for the breakthrough pain. Okay, the dose of breakthrough analgesics should be equivalent to 1 by 6th or 1/25th of the total regular opioid dose. So you will be getting the opioid dose, and always do 1 by 6th of the total opioid dose. It will come the breakthrough pain. It is so important on your written exam. It will be coming on your written exam. Okay, remember this one. And urine color. Okay. Okay, and urine color is also so much important for your written exam mainly. I haven't seen any question regarding the color of the urine discoloration on the oral exam, but you might face that one, so just you might get that one too. It is so much common for the written exam, so just highlight, just tag on the urine color too. Okay, and okay, there was the prostaglandin analog eye drops, bimatoprost, latanoprost, travoprost can change the eye color by increasing the amount of brown pigment in the iris. Okay, it was the question that came in the written exam. Okay, highlight that one too. And there were some of the drug, let me check. Okay, red orange color of urine will be red orange, which is common in the rifampicin. It was a common question for the intern written exam. Okay, just highlight that one too. And after that mist pill. Okay, mist pill, missed dose of contraceptive, just highlight that topic. It is so much important for your written exam, your daily life practice, and also for your oral exam. Okay, with this one it will be saying like, if for example there is like, if for example, I'll go with labeling. If they miss the wonders of the labeling, it is within 12 hour, what to do. If it is after 24 hour, what to do, and for how many extra days they need the protection. It has all the information regarding that. It will be so much easy if you go through this one on your daily day-to-day practice too. Being a pharmacist, if you need to counsel the patient on the new drug, it is so much easier on this one. Okay, and it might this might come on your oral exam to the, so just highlight that one. Okay, and after that we will move to INR range. Okay, with this one, okay, uh, just highlight on this one, there is the INR target ranges, okay, prophylaxis of the DVT including the high risk surgery. Okay, it will be coming on the exam, okay, either on the oral exam or in the written exam too. There is the ranges. You don't need to totally remember the range. If you can't remember, just you need to know where is the thing to look. Okay, this is the page to look after. You need to know that in the day-to-day practice, when you become the pharmacist, when you go day by day basis, you will be used to those things. So for now, just remember where to tag. Okay, and after that, I think that is the last one. What are those? Okay, it is the therapeutic monitors. Okay, therapeutic drug monitoring indications. Okay, there are the ranges, all the things. Just okay, highlight this page too. It is not that much common, but just highlight this one. And finally, there is the pharmacokinetics data. That means what is the half life, clearance of all the drug. Okay, and lastly, there is the wound management, which is not that important, but I said just go through that one too. Okay, and for example, as I mentioned, there was some of the drug I haven't highlighted that one because I had to gone through the other copies too for that one. So for example, for the tinea, here is the legal and professional obligation. That is the counseling part and all the disease condition. As I mentioned, there is the guidelines for the pharmacist, treatment guidelines for pharmacist. Okay, for example, there is the tinea. Okay, and which when to refer, is it the patient need. Okay, and management plan and what to do. They have all the thing on this one. Okay, and there are type of tinea. As you know, tinea is the fungal infection. There are many type of the tinea, so it has given everything. Okay, it has given you the condition and treatment protocol. It has given you the management plan, management choice, and non-prescription treatment for tinea infection, because you need to, in the exam you also need to talk about the non-prescription treatment for the those condition, and also in the children what to give and how to go through that one. It has an urticaria. It has all the treatment guidelines for the pharmacist. Okay, this is pretty much about this book. And in day-to-day life you can see some of the, let me check. Okay, you can see the formulary in the day-to-day life. This is important. This book is also important for the, as I mentioned, day-to-day life too. In the day-to-day life, if you need to do the compounding or the formulary of any of the drug, compounding of any of the drug, you can follow these guidelines. These are the guidelines to be followed. There are other thing too. Many pharmacies have their own guidelines based on either this book, there is Martindale, there is other thing too. So they can follow any of the guidelines, but yeah, these are the so much common thing, okay, for the day-to-day life. And this is pretty much about this book. If you like my video, you can give a thumbs up, and if you have any queries on this one, you can comment on the section below. And thank you so much for watching my videos. Keep supporting me, and thank you. Have a good day. Bye.